What's up, guys? Welcome to Waiguo Friends English and another interview.
Today we're going to interview Yulius Haryadi. He is a practicing physician here in the States. In this interview, he really walks us through what was it like to be an ESL learner coming to the States as a practicing physician. And he says something in the interview that is honestly changes the way I define what fluency really is.
And that's what we really want you guys to pull from this interview in particular is what is fluency and what level of fluency are you aiming for? And it also gets into other parts of fluency that get no attention from any of these channels. It's something we've brought up a lot. It's paralanguage. So pay close attention to this one. It's a really good interview and just you can learn a lot from Yulius here.
Yeah, you can obviously find his links in the description below, and we'll talk more about that at the end of the video. So, Yulius, who are you and what do you do?
So, my name is Yulius Haryadi. I'm internal medicine doctor. Currently, I'm working at Wentworth Douglas Hospital and Wentworth Health Partners Internal Medicine. Part of Mass General Brigham is, actually a large health institution in the East Coast. So I'm pretty lucky working at Mass General. I can't imagine I'm actually able to work at Mass General Brigham. But I'm working as a primary care physician. That's pretty much my main job. But sometimes I take shift. So I work as hospitalist per diem on the weekends, get some extra money to pay for my vacations. So that's who I am.
Wow. How was that process of you actually winding up there and being a primary care physician here in the States? What was that process like for you?
So it's a really long journey. So I originally from Indonesia. So I'm a non-US IMG. That's what they call it. So non-US international medical graduates. The U.S. medical graduates basically mean the U.S. citizens that probably study abroad, and then they come back. But I'm non-U.S. IMG. That means I'm completely a foreigner. I complete my medical school in Indonesia. And then after that, I did a social service for 1 year because that's required. And then after that, I want to come to the US. So it's a long journey. I need to complete the exams and then get letter of recommendations from physicians here, doing rotations. I didn't do much research. I did research back in Indonesia. Once you completed all the steps, then you apply for the residency programs and then you get interviews. At that time, before COVID, it's in-person interview. So I have to travel. It's fun. It's really fun. I enjoy it, like looking at multiple places in the U.S. I went to Mississippi, Tennessee. I went to Nevada, Reno. I went to multiple places for, travel and then having interview. It's a lot of fun. Now it's really boring because everything is virtual. But anyway, you save money. Whatever. Yeah. So I did those interviews and then we rank the program. And then if they like you, they will rank you high and then you'll match. That's what we call it. We match into the residency program. So I matched to St. Francis Hospital, Evanston at Illinois, Chicago. Trained there for 3 years. Then looking for jobs. I always wanted to go back to East Coast. I live in New York for 3 years. I enjoy living in East Coast. That's where my friends are. My journey actually started in New York because I did the Kaplan prep for my F1 visa. So we have to have a way to get a visa, apply, and then stay in the U.S. And I made some friends, church friends as well. So we are really close. And even now, I'm planning to go to Disney World and Florida in next month with them. 3 years enjoying New York. Went to Chicago and I always want to come back to East Coast. So I'm looking job for East Coast. And so I ended up in New Hampshire.
Wow.
Yes.
Man. So with the 3 years in New York and the 3 years in the Chicago, Illinois area.
Yeah.
And then how long have you been in New Hampshire now?
4.5 years now.
Man.
Yeah.
That is a journey.
Yeah.
That's a journey.
Quite the distance too. So where was your English when you came over?
Woo, awful. I have come to US many times. First time I came to US was, I think when I was 5th grade, elementary school. That was just for a vacation. We went to Disneyland with my parents, etc. My parents are basically Chinese from Jakarta, and they are very Western oriented. The West is amazing. They're awesome, Indonesians. So you have to go abroad. You have to study abroad. Don't be like us, So I always wants to go abroad because that was kind of invested in me since I was small. So I went there again for my brother, who is 6 years older than me, when I was 1st grade, middle school. So for my brother's college. So I went to US multiple times already. But after my brother, finished his college and we went there for his graduation, whatever, he always make a fun of me because I understand everything that people said, but I can't speak.
Yes. Oh my
I just
goodness.
can't
I totally
because never
agree.
use it. I never use it. So I don't know if you noticed, but basically in medicine, in your brain there are two places of language. One is the Wernicke, and the other one is the Broca area. So Wernicke is the comprehension, right? The Broca is the talking, speaking, output. Now, I don't have any problem with the comprehension. My Wernicke is good because I've been, playing games since I was small, Final Fantasy and stuff. They use like English, so I understand really well. I listen to the conversation, English movies, so I can understand and comprehend very well. But when it comes to speaking, I never use it. So my Broca is underdeveloped. Never use it. There is no fluency at all. So that's what happened when I first come to the US. It's like I understand what people are saying. I can read. I can answer questions in exam. I did get a good score. Step one is 258, which is pretty close, like 90th percentile or sort. So that's how I tutor USMLE. But can't speak. I just can't say. I cannot respond using emotion, empathy. I can't speak. I can't do it.
Yeah.
So
You
how
had
did
those interviews.
Yeah.
How did you do that?
Wow, that's difficult. So actually, before COVID, there is this test. So USMLE has multiple steps. USMLE has step 1, 2 CK, 3, and then there's a step 2 CS. Now, step 1 involves the basic science. They ask you, what's this muscle? What's that muscle? Actually, it's more difficult than that. But anyway, step 2 CK deals with clinical. Okay, patients come with chest pain. What do you want to do next? Okay. Step 3 is very similar to step 2, but there is this one test called the step 2 CS. Step 2 clinical skills. Now, this is really scary. Why? Because you will enter 12 rooms with 12 patients, and then you have to take history and then do exam, etc. And then after that, you step out the room and you have to write the notes. This one is a very scary exam. This exam is gone now because of COVID. Or thanks to COVID, I guess. I mean, it makes sense, right? You have to hire people and then get in the room and then interact. They get rid of it. And now it becomes very easy. Occupational English tests. It's just very easy now. But there was step 2 CS before. And I was in the era when I did my need to do my step 2 CS. That was really scary. I mean, to be honest with you, after I finished the test, after I completed, I called my wife and I said, probably we're gonna go back home to Indonesia. I don't think I passed this test.
Oh man!
And you need to wait 1.5 months until you actually get the result of the test, whether you pass or you just need to pass. But even passing, it's just so difficult because suddenly you have to, take history, and sometimes they're gonna make a very difficult case where you need to empathize with them and then try to understand them and all these things. I have no idea how to do it. Well, that was 1.5 months crazy wait, and apparently I passed. It was high pass, actually. I was surprised it was a high pass. I didn't know what to do. I thought I was gonna fail. I think I blew up like 2 or 3 cases. Like, I don't actually know what to say, I just don't know what to say. How did I do that? Well, there is a course for Step 2 CS course. So I enrolled to the course. It was like 3 days course where there is a mock test, exam, etc. It was a money-making business for a lot of people at that time. And how I passed it? Well, I mean, I did that. It's not really a good course, but at least give me an idea. And then I practice it with my friends. The thing is that you don't need to have a full fluency. You just need to have the fluency for that particular settings. At the end of the mock exam in that course, I actually was really scared. I think they gave me like a very low pass or something. And I asked, what should I do? Should I take the test? Should I do more courses? And he said, basically, well, there's this book in the Step 2 CS book, First Aid. It has all the phrases like, oh, I wish things are different. Oh, you must be very upset with this. Blah, blah. Okay, you go memorize those phrases. That's it. That's basically what he told me. This is the way to do it. Just go memorize those phrases.
Wow.
Because, I mean, what else? I mean, I won't be able to do it naturally. So I'll just have to memorize. And then so I memorize all these basic phrases, and so I can just say it to them robotically.
Yeah, there you go.
And
But
apparently that gives me a pass.
Yeah.
So that's how I passed that test. And then for the interview, etc., what happened is I start tutoring USMLE after the CS. I figure like I need to do something, and I tutor USMLE because I got good score. I enjoy teaching. Back when I was in Indonesia, I also teach Indonesian medical license exam. I teach that, so I really enjoy teaching up until now. That's what I'm doing. So I teach USMLE, and I teach USMLE multiple hours a day, like 4 hours, 6 hours. And after I complete my exam, basically that's what I do, like the whole day from morning at night. So that's how I improve my fluency. Yeah. So that's how I become fluent during the interview.
That was really clever. A nice way to like kind of like finish the step and then kind of turn back around and help people. And I think it's really shown, like it shows even how you handle yourself now. And I'm sure it has really helped you in the future just to continue to progress, right? It's those like automatic muscles that we have to like train up to become
Keep training.
automatic. That's
Exactly. I think the only way is to have a lot of output. However, that doesn't mean that I don't struggle when I start my clinical rotation or when I start my residency. Like I said, it felt like the fluency is related to a certain particular settings. I only really good at one-on-one teaching. But when I do the rotation, I need to communicate with the nurses, with the other staffs, with my colleagues, with the attending, doing case presentation, and with the patients, which I barely not do at all because I become a hermit, which just teaching a USMLE. I can easily explain things, pathophysiology, etc. But interacting with people is different. So when I first start my residency, I struggle a lot. I'm so tired because it's just there's so many words and idioms, all these things that come at me very different, never heard it before, and I need to digest it. It's very tiring. So on top of that, I need to learn the medicine. I need to learn the system. I need to take care of people. I kind of remember my first day. I come in the morning and review the chart, and then the nurse come in, doctor, this patient has a fever. What you want to do? And then after that, the phone ring, and then the pager beep. So multiple things and multiple people talk to me all at once. While I'm still learning what I need to do, and exactly, it's overwhelming. It's so tiring to speak in that settings. It took me more than 6 months, I think, until I, kind of like get it comfortable to do the work and interact with people. And I think not until close to a third year that I can actually interact with my patients comfortably, in the way of I can address their concerns. I can show up my emotions and then understand exactly, not just using the phrases robotically, but actually help them if they need some water or they actually need to not drinking anything, try to help them understand and reduce their frustrations a bit. I think it's close to the third year. That's when I start become way more comfortable. So it takes time.
it does. It does. And that was like, that took that long. It's about 3 years, like the onslaught of all the different things in the hospital setting, right? In the clinical setting. So we talk a lot on this channel about functional fluency. Like you can fluency is different depending on the person you're talking to. Like to be fluent in a restaurant setting is very different than being fluent as a doctor. What you're talking about is like, you could memorize the phrases and you can operate, you could get through the test, you could do all of that. That's functional fluency for that context. Now we get to actually practicing. Now we get to actually interpersonal skills. Like it's all different fluency. So functional fluency in that sense, you've just been expanding it.
I've often said that was one of the probably most difficult language skills is actually when you're in a room, like a conference room, and there's a lot of different things going on at the same time. A lot of different perspectives, people are talking to different people, and there's this kind of web of relationships that are happening. Like you just said, like you're trying to answer one person and the phone rings and you're trying to do notes with that hand. That is a ridiculously difficult skill language-wise. And so man, well done. I think people undervalue, like they understand, oh, being a doctor is hard. I have a couple of doctor friends and they say the same thing you just said, that it's not so much a matter of like intellectual knowledge based, like this is how this muscle pulls that muscle or whatever. It's not like that so much as like just the onslaught of just all this stuff that's happening all at the same time, and that is
And do it all with very little sleep.
and do it with very little sleep, and you have to just try your best. Oh man, that's and now in your second language or in your not your native language, man.
It's amazing.
Yeah, in
Well
a second
done.
language. Yeah. Well, I think my colleagues do a lot of better than me. I mean, I think they speak so fluent. So I don't want to make any excuse. Oh my God, I'm so tired. I don't even understand what Dr. Behai is talking about, with her New York accent. And so sometimes it's
Yes.
tough. At different attendings, we deal with many different attendings with way multiple different accents. Probably easier for you to understand different accent as a native speaker, but for me, it's tough. Some people just speak super fast.
Yes. Yes.
You're in the Northeast. It's very different there. Very different than Tennessee or Mississippi, like you had been before.
And in the medical world, like it's a very stressful situation. Not many people come up to a doctor being like, I am a normal person. I have nothing wrong going on. And so as a result, I'm going to respond normally and
Yes,
respectfully. Like
correct.
you don't get that. A lot of times
No,
I have a
no.
doctor friend
Hospital,
who,
no. Yeah.
no, it's tough. You're supposed to, you're supposed to be empathetic to people, and sometimes they do not share the empathy. You know what I mean?
No.
It can be really rough sometimes.
Yeah, yeah. I mean, hospital, they are in the worst, position their life. They are very sick, and some people just very frustrated. Nobody wants to be in a hospital. Go ahead.
So when you were in this time, right, in this residency time, this onslaught of information, what were some things that you did to improve your English? So like when you were training and learning and growing, what would you suggest for people and if they're facing a similar kind of onslaught of information to grow and improve their English during that time?
So if we talk specifically about English, my answer is pay attention and mimic the one that you feel is most ideal for you. So there are some attendings that really good interacting with patients. There are some attendings that don't. And so you don't want to follow those attendings that don't interact well with the patients. Okay? And then you start picking up and then try to mimic the attendings that do really good. Here's the thing. The difference between, maybe not really apply to you, but the difference between learning in residency and learning just exam or USMLE. So the evidence showed that the less resource you use, the higher your score going to be. So rather than you use 3 different book of pathology or 4 different book of physiology, you want to pick one, probably one that will explain all of them. The less resource, the higher your score going to be. So that is the principles. But when you go to residency training, you learn from multiple different people. So you probably learn from 3 different cardiologists that will recommend 3 different things for the patients. There is gastroenterology, GI rotation was the worst for me because there are 3 different attendings and then they change every second day or sometimes every day. So one day this patient was seen by Dr. A and then they recommend do this, and then the next day the doctor will recommend a different one. So that can be confusing for learning which one is the correct one. Every doctor has their own judgment what's the best for the patient. Same thing with learning language. So some doctors will explain in this way, and so you want to pay attention to the doctors that you're close to your most ideal way in interacting with your patients, and then you follow that and you pick good things from each and every attending. I think specifically for English, that's I think the best way to do it. And another thing, this is more technical. I would highly recommend people to do a palliative elective. I did 2 months of palliative because I realized that I think I need to improve my communication skills because palliative care deals with a complex patient's case that requires complex decision making. Patients are very sick, they're demented, but the patient is probably Jew Orthodox that doesn't want a DNR DNI, which is do not resuscitate and do not intubate. So they want to keep full code for the rest of their life, and then it's not meaningful, and you have to have that discussion. Sometimes we have to have discussion to to transition them to hospice, for example, or comfort care. So we deal with multiple palliative deal with very complex situations, and you want to learn from them because that's their job basically.
Yes.
And so I did 2 months of that. That really make me comfortable. Now I'm very comfortable if there's patients that are really sick and then pretty much dying, and you need to explain to the family, and I'm comfortable actually doing that. I'm confident doing that because I did 2 months of palliative. So I think that I would highly recommend, for a resident to go palliative elective in their residency to improve their communication, interpersonal skills. Very useful.
Yeah, that's a very touchy subject with many cultures,
Yeah.
right? Especially here.
Yeah, and I think for me, like, I don't know, that's like the clearest version of like fluency. Like I really want to get people to understand because fluency can be such a vague term sometimes, but like that's like the example in my mind of like how do you talk to a person and do it well, like you just said, like using an Orthodox Jew as an example, where it's like, do you have to take it part and you have to understand the culture and their mindset enough to not just say, this is what we do.
Yeah.
And this is the rule. And it's like,
Right.
oh, you can't, like, you gotta cross the bridge a little bit. And
Yeah.
that's really cool. That's a really, really good training.
For somebody out there who might be listening right now, what would you suggest to them is the most important thing that they can start doing now to get matched in the US?
But like before they even like leave their country?
Right, before they leave their country, let's say they're studying, they're not quite done yet. Maybe they haven't even chosen their specialty yet, but they're training, they know that's where they're going. They want to come here. What's the best thing they could start doing now to get matched?
Well, that's kind of complicated because there's so many multiple steps involved in order for you to match. There are checklists that's required, so you have to complete those checklists. So there are technicals, right? You need to complete your USMLE, you need to get ECFMG certified, which is ECFMG stands for Educational Committee for Foreign Medical Graduates. They're the one that decides, okay, this guy who is foreignly trained is certified to come to the US and work and apply for residency. Now, in order for you to get certified, you need to complete all the steps because these USMLE is the test that's given to everybody, including the Americans. They do the test. We also need to do the test. We standardize, you see. So definitely study for the USMLE would be very first thing to do and very, very important to do. But I highly recommend once you completed the step 1 and working toward the step 2, that is the time when you start searching for rotations. Now, I would highly recommend they complete the steps to CK, which is the clinical knowledge, before they do the rotation, so they have good medical knowledge when they do rotations here. But then that would be the best time to polish their communication and interpersonal skills, definitely, because these skills will get you really far. The thing is this, the score is very important, but I have students who fail the step 1, fail the step 2 CK, and finally pass it. I tutor him and still able to match thanks to the communication and interpersonal skills. He's amazing. He's great. People would love working with him. Even if you fail your steps, you can match with communication interpersonal skills. If you really have a good score, you cannot match if you're doing awful in your interview or during your rotations, you see. So it's very important to have that skills. Yeah, but definitely you need to work on the USMLE because that will really, still you can match with that, but it will be very difficult. So you have to open up all the possibilities by having a good score because the programs will not see your CV at all. You'll be invisible without the score. So if you're below certain cutoff, you're invisible. They don't see. You're not even there, even though you already put your money and then apply to that particular program. They will not be able to see it. My program exactly does that. They put a cutoff score of 250, so they want 90th percentile above students only with their score. And if you're below that, they can't see. So there's no point then, right?
Yes.
There's no point. So that's why you have to do the score first. Now, once you get the score, then you can polish all the skills that you need. Yeah.
You talked a lot about this interpersonal skills and this communicating. How is the American medical system, as you see it and as you operate in it daily, how is it different working with the patient versus in other places in the world?
Yeah, I only have work in two places, which is Indonesia and here.
Right.
So other things are hearsay. But it's very different, very very different. How it's different? Well, patients' autonomy definitely. Patients have more autonomy in the U.S. We suggesting and we recommend, and the patient, it's up to the patient whether they want to go for it or not go for it. Um, in my country is, well, I mean, doctor has more of a lot of authority over the patients. Although we still exert autonomy, that's important. But I think it's just, I think it's more enforced in the
Yeah.
U.S. So that's one thing. And then I think, in my opinion, now this is could be quite a sensitive topic here. The main difference that I see is that in the US, we have to exert our due diligence. So, for example, if I recommend a patient to get a colonoscopy and the patient say no, to exert my due diligence, I have to explain, well, there are other options. Right? You can do the stool test, you can do the blood test, you can do this test, and then I tell you the risk, the benefit, etc. And then the patient probably say no. And then after that, I meet the patient again in 6 months, is my due diligence to explain again and then see if
Oh,
probably they change their mind. Let's say they change their mind. Okay, I'm gonna go get my colonoscopy then. Okay, I put the order in. And then after that, the patients didn't show up. And then it's our due diligence to call the patient and say, hey, I think you missed your colonoscopy. We're not going to do that in other countries. No.
yeah.
If you don't advocate for yourself, you don't care about your own health, we're not going to be the one that care for your health. You don't
Mm.
care. But here, I think it's because of the lawsuit, etc. We have to make sure that it's as safe as possible. Can't tell you how many patients self-sabotage.
Yeah.
And I think I care more about him than he cares about himself. You
Yes.
see?
Yes.
So, but why I have to put all this effort here? But we keep doing that. I keep calling. We keep telling, hey, you know what? We need to do this. Can you get your blood test done, please?
Yeah.
It's his health why I'm doing this, but I have to do that and I have to document that I do that.
Yeah.
So that doesn't exist in my country.
Perfect observation. It happens with teaching as well in a lot of cases.
My friend who is, a current, like, who went through residency, did all the things as a natural American, he says that's one of the most frustrating parts of his entire job is like, I am trying to help you. I'm trying to help you, and you
Yeah.
are pushing back at me. Like, I don't know what to say. Like,
Yeah.
I can only say these are the things that have been clinically proven to help you and your lifestyle get better. Please do that.
And actually, it's not like I'm blaming them of not doing it. So don't get me wrong. The issue is the system that keep pushing us to exert our due diligence, and I don't know how far we should do it. Yeah, I mean, I have a lot of Indonesian patients back then that doesn't want to do it. I'm not gonna be upset with that. I mean, everybody has their own choice. I'm completely have no problem with that. But my problem comes with we are as providers feels really scared if we don't exert our due diligence because all these malpractice and lawsuits etc. And then we document. So that's the part that I actually don't like. That the feeling of we can get in trouble if we don't advocate for the patient that does not advocate for themselves.
This relates to the fact that you are a PCP, a primary care physician,
Correct.
right?
Correct.
I have heard stories, and I don't know if this is true, but in doctors of other kinds, like surgeons or specialists, where they don't deal with like the same degree of, rotations or clinicals or stuff that's like, the frustrating parts of the job sometimes. But for those people, for a person that's wanting to be, not just a general surgeon, but like a heart surgeon, very specialized stuff that they already do in their own country, do they have to have such rigorous training, like interpersonal communication training, just the same? Or do they kind of get a pass because, all they do is they just stay in the OR all day, basically?
No, they have to go to a clinic. Yeah, they have to go to clinic. But I guess my question is, are you asking do they have to repeat residency even though they have already specialized in their home country? Is that the question?
That is one of my questions, yeah.
The answer is yes. Yes. Right now, actually, I mean, probably I shouldn't say yes immediately. The question is how you as a foreign doctors can work in the US as a doctors, then we're dealing with 7 different paths. Okay. There are probably 7 different pathways. 6 or 7. Yeah. So there are many ways to do it. If they have to repeat residency, there is a way to not repeat it. But that's not a common way to do it. And right now, I think it's not a reliable way to do it. There's a pro and cons there. Like you cannot be board certified, for example. You can only work in one state, for example. So and then you have to be like highly recognized, super skilled thoracic surgeon that done one kind of a million type of surgery. You probably have to be that good, in order for you to bypass everything. Okay, you're like a godlike thoracic surgeon. We are way below you. There's no like we teach you anything. You teach us. So that's very rare. That's very rare. Mainstream way to become a doctor is my way, which is you do your USMLE and then do your residency, and then you'll be board certified. Yeah. Now, in terms of do they need the communication skills to, right, as a surgeon, the answer is definitely 100% because they have to talk to the patients before doing the surgery, explain everything. And then after that, there is a post-op. So they have to deal with any post-op complications, definitely. And I think even more important in surgery. Why? Because the reason is you are more prone to these malpractice lawsuits and mistakes. When it comes to procedures. Me as the primary care, we don't really touch the patient that much, you see. Very, very rare. And then internal medicine hospitalists maybe a little bit more, but they still don't touch the patients. The one that procedure-based are more prone to lawsuit. Now, in my opinion, the best way for you to avoid the lawsuit is make the patient like you. Even if you make mistakes, the patients would be okay because they enjoy, your presence and then you taking care of them, you see. So that's where the communication and interpersonal skills come into place, you see. So I think it's even more important than the internal medicine, ironically.
Another alternative I wanted to ask about, I know that some people, they go the medical school route. Right? They go to medical school. They pass all the tests. They do all the things. Is that a more viable way? If you had to restart all the way at the beginning, is that a harder route, do you think?
So that would be the second pathway, right? Yeah. Basically, that's one of the out of the 7. Yeah. So you can go to the US and then do your undergrads, then you do your medical school, and then after that, yeah. So that's what my brother did. Yeah, that's what my brother did. He went to undergrad in the US. He's Indonesian like me, obviously. Yes. And he completed his high school in Indonesia. And then after that, he went for college in the US and do everything. I don't recommend that. Why? It led me to a family debt. A high amount of debt. So I don't recommend that actually, but it can be done. There are 2 issues, like one is money, 2 is time. It takes too much time. I think my brother graduated from his residency, and a year after I graduated. I'm 6 years younger than him. Whoa. And I make pretty much the same money. So there's no point. And I don't have any debts. I have 0 debts.
Whoa.
I'm surplus. Yeah. So I don't recommend that route. If you are U.S. citizens, I would probably recommend just go to Caribbean medical school. There's no undergrad. You go to medical school right away. The tough part is, again, you'll be like U.S. IMG, but it's better because you have visa and you don't have to apply for a visa. So you still have the advantage. You save time. You end up making the same money anyway. Probably you won't be able to be trained in the highly prestigious academic university, like you won't be able to be trained in Harvard. Probably you won't be able to be trained in University of Pennsylvania or some sort, And it's your preference, I guess. If you want to have that prestige, I make the same amount of money.
That's awesome. Yeah. All right. Well, Yulius, you have shared so much information that's going to be so helpful for so many. So where can people find you if this is the route they want to go, if they want to meet with you, work with you somehow? How can they find you?
Sure. You can find me by type my name in Google, Yulius Haryadi. I have a website, so yuliusharyadi.com. I have my YouTube channel. That's also my name, Yulius Haryadi. You can connect with me via LinkedIn. Again, that's you can just put my name and you can find me. And I have an email address that's Yulius, my first name, at juliusharyadi.com, and you can email me. I'm pretty responsive to email and then LinkedIn. I have free stuff that's actually available in my website. I have two free stuff right now. One is the USMLE test taking strategies course. So it's a free online course. It's free online course for test taking strategies. I help people to approach the questions, how to approach USMLE questions, how to deal with 50-50, so you increase your chance to get your 50-50 correct. And I have time management strategies, so you won't run out of time when you do your exam. So that's completely free. I actually posted this once back in when I entered my residence 2017. At that time I put it in SDN, and then when if you type after a while, if you type USMLE test taking strategies, that's the top number one. It will show up at the first Google search. So I changed that in form of video now, and it's just free to take. And the other one is if students looking for clinical rotations and try to prepare for that, I have the complete guide of when to start looking for rotations and what are the types of rotations are there, and what are the hospitals that offer rotations for foreigners, non-US IMG, like me. So it's all there. It's free. Just go to the website, ulisharyadi.com.
Thank you so much for being here, and thank you so much for getting on this call. I know there's a lot of people that have these burning questions, and they're wondering, where can I find help, right? And that's so cool that you are already in there. You've already walked the same path, right? This
Exactly.
is this is a
Yes.
thing that we do with our students to say, you need to find somebody that's slightly ahead of you so that you can learn from them. Not too far, because maybe some rules will have changed, but just far enough that you get that information and those tips. I would have never thought of Caribbean. I would have never thought of that. So I'm so grateful that
Oh,
just tips like that are just
cool.
immeasurably
Cool.
helpful.
Cool. No. You're very welcome. Well, thank you for having me. I mean, I have a lot of fun sharing with all these stories with you guys. So